Hello, my name is Hanson. I'm a respiratory therapist student here at Miami-Dade College Medical Campus. The reason why I chose this profession is because growing up, I always knew I wanted to do something in the healthcare field. My mom is a nurse, my dad is a respiratory therapist. So I remember at some point I was doing my research on respiratory, and I really became interested in a lot of different things that they do to help care for their patients. One of them being that we manage very sick patients on the ventilator. And while being in the program and going to clinicals, at some point I really felt like this was a great profession for me and it fits me. Being a student here, I'll say, is all about trusting the process. The program is challenging and it can be hard, stressful, but the professors here are very caring, they're very knowledgeable to help get you where you need to be. I started this program about a year and a half ago, and I learned a lot, and it seems like it can be overwhelming, but eventually everything comes together and it all makes sense. MDC has prepared me for the real world, not just by knowledge and what we learned, but I think the most way that I learned is the hands-on experience that we get to have in the lab and going to clinicals. When we go to clinicals, we are familiar with things already because we learned about them in the lab.
Respiratory therapists are trained in a wide array of assessment techniques and therapeutic procedures to help patients breathe. In the healthcare industry, respiratory professionals work at the bedside with critical care patients to help manage their ventilator and liberate them from the ventilator as soon as possible.